So as of today, we now have 4 confirmed cases and 1 suspected case of measles. Right, so during the declaration on the 8th, we had mentioned that there were 3 confirmed cases and 1 suspected case. So that suspected case is now a confirmed case.
At this moment, the Navua team, the Serua Namosi Sub-Divisional Outbreak Response Team, which Dr. Ana, of course, leads, is working very hard to ensure that this outbreak stays within the borders of Serua Namosi. So far, the confirmed cases have all come from 1 settlement in Waqainabete, which is a Wailali settlement, and all of the cases so far, the confirmed cases, are all linked to each other. So what this means is that it's confined within that area. So at the moment, everything that the Sub-Divisional Outbreak Response Team is doing in terms of responding to the cases, in terms of responding to suspected cases, which includes isolation, making sure that they're not getting in contact with people within the hospital. They've set up triage areas in the hospital so that suspected cases are separated from the general public. The teams are going out into the settlement itself and making sure that they're vaccinating as many people as they can within the affected area. They're doing all of this with the intent of keeping this outbreak within the boundaries of Serua Namosi. And right now, it is just within that settlement in Waqainabete.
That's Wailali settlement.
Wailali settlement, yes. So right now, the vaccination is for everybody who lives in Serua Namosi from the age of 6 months onward, unless you're pregnant, unless you have, if you're immunocompromised, if you have a weakened immune system due to some chronic diseases, and unless you are a baby under the age of 6 months. So if you live within the Serua Namosi area, everyone from the age of 6 months and onwards is being offered the vaccine. And the team's actually going into the settlements, into the communities to vaccinate as many people as they can. The idea is that if we get more cases within the community, because we have so many people around them that are vaccinated, we actually create a buffer zone where the virus cannot spread any further and it's contained within this area. So this is just within the Serua Namosi area, which is the outbreak area. For the rest of Fiji, what we're saying is that we are still, as always, encouraging parents to make sure that their children have received 2 doses of the measles vaccine. This is part of our normal immunization program, the national immunization program, where children start receiving the measles vaccine from the age of 12 months onwards. So right now it's at 12 months and 18 months. And the way you can know if your child has received the vaccine, you look at their health card. So every baby born in Fiji receives this card. It's a national infant record. And it actually has on it how many vaccines, which vaccines a child has received. Every time you're taking the baby to a health center to get checked, they receive a vaccine, it's actually noted on that card. So check that card, see if your child has received both doses of the vaccine. They'll also may have received it in school, and you can check your school health card. If you don't have the health card anymore, if you're not sure if your child has been vaccinated or they have not been vaccinated, you can come to your nearest health center anywhere in Fiji to get them vaccinated or to check. But that is just for children. The other group that is being vaccinated around Fiji is anyone who's traveling internationally. We have been advising for the last 3 months that if you are going overseas, please make sure that you have been vaccinated. And we're advising at least 2 weeks before you travel overseas, get vaccinated. And if you're traveling to an outbreak area. So right now, Serua Namosi is an outbreak area. So I know all of you media people who have come in today to Serua Namosi to see what is happening with the outbreak response, you've been vaccinated. So if anybody is traveling to Serua Namosi, you're coming to visit family or friends, first of all, we're saying please don't travel unnecessarily. If you don't have to come to Serua Namosi, please don't come. If you do have to, please get vaccinated at least 2 weeks in advance.
So as of now, our high-risk community that we are concentrating on is the Waqainabete settlement, Wailali and the surrounding 4 to 5 settlements. Wailali settlement and the surrounding settlements. So as of now, we've reached 64, almost 65% of the total population, which is 800 plus vaccination.
This is since they started vaccinating in response to this outbreak on Thursday.
On Thursday.
This is not the normal immunization program for children. We know that in this area, actually the rate is quite high. It's about 95%. We know that the children in this area have been receiving vaccines as they should. But because there's an outbreak now, we are targeting everybody. And so they've been vaccinating since Thursday. The two teams have been working all weekend, working late into the night, 10 o'clock at night, 11 o'clock at night, to try and catch people in their homes, especially during the weekends, because in the weekends, people are more likely to be home, especially adults, because we are targeting everyone from the age of 6 months onwards in this particular area that's having the outbreak.
So until yesterday, we've reached 64.7% of the population of Waqainabete and its Waqainabete settlement, surrounding settlement.
Well, we have our Ministry of Health staff that are all of at the international airport, our health inspectors that are based at the airport. They know the signs and symptoms of measles, and they are keeping an eye out for that. We also have a passenger arrivals card, and on that card it asks if you have signs, so certain illnesses, there's a fever, there's a rash in there as well. And if anybody ticks that, of course, they will be looked after by the staff that are at the airport. Other than that, it is actually very difficult to control any disease at borders. The WHO does not recommend strict border controls, especially for measles. The reason being, there's a period where someone can spread the disease, but they don't have any symptoms. So it is very difficult to spot it. They will come into a country, they don't have symptoms. So what we want to avoid is diverting a lot of resources to enforcing our border controls when we're ignoring the more important, proven interventions that work, which is making sure that our population is adequately vaccinated, our children are protected because they have received 2 doses of the vaccine, that whenever we have a suspected case, like has happened in this subdivision, the response is very rapid. And it was very rapid in this case. We were notified of a suspected case it was last Wednesday.
Yes, correct.
Last Wednesday, the bloods were taken, the response was done, patient was isolated, the contacts of the case were vaccinated, the contacts in the community were vaccinated directly around the case. By that evening, we had a confirmed test result from our lab here in Fiji CDC, which is in Suva, which is a Ministry of Health lab. And then by the next day, which was Thursday, we'd actually declared the outbreak. We'd notified the public that yes, we have confirmed cases of measles in Serua Namosi, we're declaring an outbreak. So that time from when we first saw the first case and we diagnosed and implemented the response and tested and then notified the public was actually very fast. And we want to make sure that keeps going, because that is how we will control the outbreak, as well as making sure that we are vaccinating, we keep vaccinating, that parents make sure that children have received the 2 doses of the vaccine. As soon as a doctor suspects measles, they have been actually trained. There's guidance that has been distributed by the Ministry of Health. As soon as you suspect a case, they're treated as if that is a real case of measles. The response goes on regardless of how long it takes to get a result back from the lab. The reason because measles is so contagious. So that is exactly what happened with the first case, the 4-month-old baby, and that was the first case we were notified of last Wednesday. The team here in Serua Namosi and Navua Hospital did a wonderful job in isolating the case, making sure that the baby was away from other people in the hospital, also following up everybody who was in contact with that baby in the hospital, as well as outside in the community. So they did all of that before actually confirming that it was a lab positive measles case. That confirmation came later that night. It was on the same day, but it was in the evening. But all of those responses had already gone out.
And I think one of the important things to note is if there is a suspected case, then we will try and immunize or vaccinate the contacts within 72 hours. That's because if they are vaccinated after the 72 hours, then they still could still show the symptoms, but in milder form. So that's what we're trying to do within 72 hours. So as soon as we get a suspected case, we initiate the whole guideline on any suspected case. So again, because of the disease investigation surrounding the third case, it was during the investigation of the third case that we found out about Miss Susan. And then while we investigated Miss Susan, then we found out that the son had developed symptoms before her. So what the team did, we located his folder. But then in the folder, we've seen that he did have some symptoms, but without the rash. So he did have flu-like symptoms, but he had a cough, fever, but no rash. Yeah, I think the rash would have really been the trigger, because we have flu around the year. Yeah.
And that's something we know is very important. Is sometimes when people come to a health facility, they may come with cold symptoms, because the first symptoms of measles are actually flu and cold symptoms. So you may have a running nose, you may have a cough, you may be sneezing. So it looks like a lot of other diseases. So what is important now is that we're telling the public what the signs and symptoms of measles are. So fever and a rash. So if the public are more aware, then if you have those symptoms of cold and you come to a health facility and later you develop those symptoms of rash, you're likely to understand that it could be measles, and you come back and you see your doctor again.
And one of the best ways to monitor is the surveillance. So we've just really strengthened the surveillance within Serua Namosi. So if they're coming from around Wainandoi or Wailali, and if there's any contact with any of the suspected or confirmed cases, and of course the surveillance all over Central Division and the whole of Fiji, the facilities, that's really being strengthened so that we can monitor people coming in. So during the case finding, the case investigation, so surrounding one case, then we have what we call an incubation period, the time they are exposed to the virus and the time they show the symptoms. So if they're showing the symptoms on this day, then we actually see and ask for history of his traveling history, whether he was exposed to someone, possibly who gave him the virus, and if he did have the virus, whether he exposed it to someone else. So he did go to Nambucavesi. So right now, Nambucavesi is also in a high risk, whether the exposure came from there or he did expose.
So all of these investigations are continuing. The team every day are going out to find, it's what you call active surveillance, where they're going out to find cases in the community. They're not waiting for their meshi to come in. And part of the response, as I mentioned, is the vaccinating, the wide vaccination. And that's even before you find cases, being able to vaccinate very widely. So we're targeting Waqainabete. It's going to go even further to target all of the subdivision, all of Serua Namosi. You're actually protecting the people who live in there, and also containing this virus within the borders of Serua Namosi. The other investigation that the team are going through right now is trying to find out where it came from. We know measles is not endemic to Fiji. It's a very rare disease in Fiji. The last time we had cases was in 2016. The last time we had an outbreak was in 2006. We don't have cases on a regular basis. The cases always come from somewhere else. The virus is brought from somewhere else. This is because we have such a good immunization program that it's not normal for us to have cases in Fiji, which is why when we have one case, two cases, we actually say it's an outbreak, which is what we did in this. If you hear the case count and you're hearing that, there was 2-3 cases, why are they declaring an outbreak? It's because measles is not normal here. It's very rare in Fiji. So we know it came from somewhere else. We know that there are outbreaks happening in our region. Of course, we know it all started in Auckland, New Zealand. That outbreak spread to Samoa, it spread to Tonga. So we're trying to establish where these cases in Fiji, where they actually caught it. And we do know it will not have been Fiji. It would have been somewhere imported from overseas, from one of these regional countries.
So like Dr. Sahukhan said, somebody could have traveled in and didn't show any rash, and then probably developed and stayed here within that time of infectivity, and then probably transmitted the virus. Because it's just respiratory illness. It's just through coughing and sneezing.
So there are, as I mentioned before, there are outbreaks in Auckland, New Zealand, in Tonga and Samoa. The outbreaks in Tonga and Samoa came from Auckland, New Zealand. So as I also said that at our borders, our health inspectors know that we're having an outbreak of measles. They are on the alert for anybody who comes in with obvious signs. So anyone comes in with a fever, with a rash. Again, as I mentioned, it is very difficult to screen for measles at borders because there is a period where you may be incubating the disease, you may be infectious, but you're not actually showing symptoms, or the symptoms you're showing are very mild. You may have a running nose, a cough, flu-like symptoms, cold symptoms. So while we are keeping an eye on the border, we are very much focusing on the proven interventions that do work. So making sure that our children have received the 2 doses of the vaccination, making sure that we're responding to suspected cases in a timely manner, as has been done in Serua and Namosi, and making sure that our surveillance for the disease is very strong. So that our clinicians, our doctors, our nurses are very aware that there's outbreaks happening in the region, to keep an eye out for people who have symptoms of the disease and to respond, send in their samples to get tested so that we're able to test and confirm cases, or test and discard cases. And this happens on an ongoing basis and not just during an outbreak. At this stage, for the outbreak that's in Serua and Namosi, we have more than enough vaccine. As you know, we vaccinate children from the age of 12 months, 2 doses of vaccine. And right now it's at 12 months and 18 months. So we always have enough on hand to vaccinate those groups and a bit extra. But there's also been extra vaccine being brought in anticipation because we know we're having outbreaks in the region. So measles is one of the most contagious diseases that we know of. It is also a very rare disease in Fiji because we have a very robust vaccination program. Most of the people who get measles will actually have a fever and a rash. They may have cold and flu symptoms, and they will get better. However, there's a percentage of people, about 30%, who will develop complications of measles. Some of the complications of measles include pneumonia, which is an infection of the lungs, encephalitis, which is an infection of the brain. They also have ear infections. And so about 30% of people who get measles, we've seen this in Samoa, we've seen this in New Zealand, actually need to be admitted to hospital. What we are trying to avoid is a situation where we get to an outbreak where there are a lot of admissions to hospital. So which is why we are trying our very best. The outbreak response team that is led by Dr. Ana in the Serua Namosi subdivision is trying the very best to make sure that it's contained within this subdivision. And one of our best weapons against this disease is the measles vaccine.
Thank you very much.